Good morning, everybody. This is Dr. Evan with Dr. Evan's Almost Daily Dose. I hope everybody's having a wonderful morning. Today, I would like to talk about bioidentical hormone replacement therapy. So this is something that is quite confusing and quite controversial for many people. So let's dive in and see what it's all about. So bioidentical hormone replacement therapy is hormones that are taken that mimic the body's natural biochemistry. So it's taking stuff that our body recognizes and in the dosing that is appropriate for the body. So in contradiction to this is hormone replacement therapy, which is actually taking pharmaceutical hormones that may not jive with the body and the dosing may not be appropriate. So we're looking at two things. We're looking at the appropriate dose for the body, and then we're also looking at the appropriate chemicals. So a lot of this controversy started back in 2002 with the Women's Health Initiative study. This was a study, a very big study, thousands and thousands, tens of thousands of women were in this study, and the study had to get shut down because there was an increased risk of, or increased incidence of heart attacks, strokes, cancers, and they attributed it to these hormones, and rightly so. But let's take a look at this study and figure out what was up with the hormone. So the first thing that they were doing in this study is that they were using conventional hormones. So they were using Prempro, Premarin, and Provera. So Prempro is a combination of Provera and Premarin. Premarin is estrogens from a horse. So you may think, oh, that's natural enough. But Premarin actually stands for pregnant mare's urine. Premarin. Okay, so basically they take a pregnant mare and they take her urine and then they distill down. This has got to be quite a process to collect this urine. But then they distill down the estrogens and they give it to women orally. Now the challenge with this, and then Provera has its own risks associated, which is very high dose progesterone. So the challenges with this is that, first of all, these are not bioidentical. So horses are from nature, but they are not, their estrogens that they have are much different than the ones that we have. So that's the first thing. The second thing is that the dosing of these hormones is thousands of times stronger than the dosing of our own hormones. Okay. The next problem is that these hormones are given orally for the most part. And that means that they're processed by the liver and they end up getting changed so that they become xenoestrogens, or basically estrogens that are foreign to our own bodies that can cause autoimmune reactions. Okay, so that's, we talked about the oral issue, we talked about the dosing issue, we talked about the form issue. So basically these are forms that are not natural for the human body. Okay, so much different than bioidentical hormones. So with bioidentical hormones, a lot of times they're coming from yam and other plants that are incredibly similar, if not exactly, to our own biochemistry, and then the dosing is very low. So you can see with these hormone replacement therapies, all of those things that they were doing, higher dose, change in chemical, or taking it orally, all of those things are going to cause blood clots, increase risk for cancer. So I'm not surprised why they had to, and I'm very pleased that they shut down that study, because those hormones are not safe for humans, okay, which is why we always use bioidenticals. And so whenever I'm dosing bioidenticals, and I learned a lot about bioidentical hormone replacement therapy from Jonathan Wright, who wrote the first bioidentical hormone prescription in this country in the 80s, but he always says, copy nature, and then measure, measure, measure. And that's the other thing too, is that in this study, they're not measuring hormones. And the question is why? If we're going to measure thyroid hormone or, some of these other hormones that conventional medical practitioners are going to do, why don't they also measure the estrogens appropriately? So that's the other thing, is looking at appropriate testing. And so that's looking at urine testing to determine Are there, what's the 2:16 hydroxyestrone ratio, which looks at the ratio of the good estrogens to the bad estrogens? You always want to use, check for urine, or not urine, but uterine lining abnormalities. So you want to make sure that you're getting an ultrasound every year to make sure that that lining is not increasing and you're not predisposing somebody to having a female cancer. So those are some of the testing that you want to do. In terms of other proactive things, is that you always want to take progesterone with estrogens, and you always want to use more preventive estrogens than you do the active estrogen. So the preventive estrogen, so estriol, which is TRIOL, is the estrogens that are preventive against cancer. So whenever, and then the estradiol is the more active form, which is what you find a lot with conventional medications. And so whenever I use bioidentical hormones, I have 80% of that compounded topical is going to be estriol, and 20% is going to be estradiol, because then that confers even more protection against cancer and other risk factors. So those are just some other things that you're going to want to consider when discussing with your practitioner. The other thing that you want to look at, because of the risk of heart attack and stroke, is looking at some natural anticoagulants. And so sometimes this is nattokinase or serrapeptase, high-dose fish oils. So, depending on a person, because, this is something we don't understand a lot about, but estrogens can prevent heart attacks and strokes, but then they can also cause an increase in blood clotting and heart attacks and strokes. So you just have to make sure that this is individualized for the person. But a low-risk option is to take high-dose fish oils, and that can make a world of difference for folks. So we talked about some of the safety concerns with bioidentical hormones. And so let's jump a little, and how to mitigate that a little bit. So we talked about oral being bad. So you always want to use it topically. You can use a troche, which is like a lozenge under the tongue, but topical really is the best way to go for anything that is water soluble that can be converted by the liver. In this case, we're talking about estrogens and testosterones. With progesterone, you can take it orally because it's fat soluble, but you always want to start with low dose. You want to increase slowly, and you want to monitor symptoms. So with women who are having hot flashes and vaginal dryness and a lot of these symptoms of low estrogens, I will recommend that they start off with about 0.5 milligrams of this 80-20 compounded, what we call biest, of the 80-20 ratio of the estriol to estradiol, and then increasing every week by 0.25 milligrams until they get up to the dose that's appropriate for them. They're sleeping through the night, no vaginal dryness, and no hot flashes. And then at that point, we'll add in progesterone to balance that out, add in some testosterone if it's needed for any sort of libido, while we're working on everything else, so thyroid and adrenals, and removing any xenoestrogens and any other toxicities that might be part of the problem here too. So that is treatment for bioidentical hormones for the most part. So we talked about the safety concerns, talked about treatment. I think that's it. There was something else I was going to talk about, but maybe I'll talk about it next time. One thing I forgot to mention in the last video that John, my assistant, reminded me of, which I really appreciate, is that I wanted to give you some dosing or some lab ranges on the testosterone. So the testosterone, free testosterone for women, I want it to be above 2.0, and free testosterone for men should be above 7 or 8. All right. So that was Bioidentical Hormone 101 for today. You can read more about it in my book in Chapter 11. The book is called Fix Your Fatigue. You can find it on Amazon. Paperback should be out in a week. And if you want to come see us as patients, we still have availability for the next month or so. Go to thehirschcenter.com and follow the new patient procedure. Thanks so much for watching. Have an amazing day.